The first question is about your recent article, Advances in Photonic Materials and Integrated Devices for Smart and Digital Healthcare, Bridging the Gap Between Materials and Systems, highlights the role of photonic materials in next-generation healthcare technologies. What do you see as its most significant conceptual or technological contribution?
That's a good question. So I published this article recently, and in this article, I want to emphasize the significance of new materials, especially photonic materials, and possible applications for integrated devices. So I can say that the most significant contribution is the systems level reframing of photonic materials in healthcare. So rather than treating just photonic components as isolated units, this article that I published summarizes recent advances and technologies so that we can emphasize how photonic materials can serve as anchors to develop more intelligent and integrated devices. And also it can be used for advancing digital healthcare. In terms of technology, the key advance is demonstrating how integrated photonic structures can be co-designed with other materials like substrate, bioelectronic sensors, and data analytics, such that it can enable scalable, high bandwidth, and wearable health monitoring systems. So overall, as I said, that this materials to systems perspective is essential for developing next generation healthcare technologies.
Okay, thanks for sharing. And the second question is about your research spans soft robotics, bioelectronics, human-machine interfaces, and nano-microstructured devices. How do you strategically integrate these diverse fields to address challenges in health monitoring, disease diagnosis, and therapeutic systems?
Yes, so my approach is fundamentally problem-driven, based on identified issues and challenges in healthcare. So in terms of health monitoring, diagnosis, therapy, there are a lot of simultaneous constraints. For example, mechanical compliance, biological compatibility, signal fidelity, and long-term reliability, and so on. So the bottom line is that no single field can solve these problems alone. So that's why I think it's really important to integrate knowledge and technology from diverse fields. That's the strategy that I'm following. For example, I can give you a few cases. Soft robotics research can provide the fundamentals of mechanical and structural framework that allow us to develop devices to interface seamlessly with dynamic biological tissues. Also, like bioelectronic systems can offer the electrical, electrochemical, biological transduction mechanisms. And nano microstructure devices can enable high sensitivity miniaturization, even high spatial resolution. In the meantime, human-machine interfaces can close the loop by translating raw signals that we are getting from sensors into actionable information. So that's why overall this strategic integration happens through designing multiple aspects simultaneously from the beginning rather than sequentially. What I mean by designing simultaneously from the beginning is that we integrate, again, like strategies and technology from different aspects, including materials, mechanics, electronics, packaging systems, and data science, right? Then overall, it will allow me and my group to build new platforms that are not only functional in like control settings, but also robust and reliable in real world environments.
So the next question is about among your recent achievements in nanobrain implantable electronics and nano biosensors, which breakthrough do you believe has had the greatest impact so far? And how close are these technologies to real-world clinical or translational applications?
Yeah, that's a good point too. Um, as I briefly mentioned that my research uh, touches multiple areas of sensors and electronics. And among my recent work, I developed ultra-thin nanomembrane-based implantable electronics uh, combined with like, highly sensitive sensors so that you can detect signals like electrolytes, pressure, flow, or strain changes. The key thing of this technology is that unlike existing or conventional implants that typically require surgery, our device doesn't require any surgery because it's a minimally invasive system that can be delivered into the body by using a catheter. Again, compared to like existing implantable devices, our system is low profile and it has its own advantages, uh, such as its circularless, batteryless, and also wireless. But it's transmitting data without using those sophisticated electronics. So the size becomes really small compared to other devices. At the same time, it's unique that we can offer mechanical invisibility, long-term stability, and also high signal quality. So overall, these are critical for chronic implantation. And what makes this impactful is not just performance, but also the compatibility with existing clinical workflows that don't require surgeries. And to answer your last question, right, considering translation, we still have challenges in like large scale manufacturing, packaging, and regulatory validation with animal models and human subjects. So overall, I would say that this type of implantable system is still in an early stage of commercialization for immediate clinical applications.
Thanks for sharing. And the next question is about smart machine intelligence and deep learning. Increasingly important to bioelectronic and healthcare system. How do you envision data-driven algorithm reshaping the design, functionality, and the reliability of future soft and implantable electronic devices?
Yes, so these algorithms, right, data-driven algorithms that we develop, can fundamentally change how we think and how we design our sensors and bioelectronics. So traditionally, right, when we design these devices, uh, they are designed to produce like clean data signals, and they are isolated signals. However, with like machine intelligence and data-driven algorithm, now we can instead design more distributed, multimodal, and even like non-perfect sensors because we can rely on algorithms to extract meaningful patterns that we couldn't get before. I hope that makes sense. right? Then, based on that, deep learning that everybody is very familiar with these days can enable adaptive calibration, drift compensation, and also personalized interpretation of complex physiological signals that we're targeting. Particularly, these are important for like soft implantable devices that I just mentioned before that typically experience high mechanical deformation and biological variability over the course of time. So when I think about future, right, I see this intelligence becomes an intrinsic design parameter. So devices will be optimized with algorithms and also designed with algorithms from the beginning that will allow us for having new capability for like self-tuning, fault detection, and predictive diagnostics. So ultimately, this new algorithm and data-rich situation will lead us to develop our bioelectronic systems that are not only just smarter, but also more reliable and clinically trustworthy over long-term use.
So, looking ahead, what do you see as the most critical and the most promising opportunities in building fully integrated digital healthcare platforms that combine photonic materials, soft mechanical structures, bioelectronics, and intelligent systems?
Yeah, so I want to give you like comprehensive overview and the direction I'm thinking. As I just shared with you, I think now this fully integrated devices and healthcare platforms should combine again knowledge technology components from like multiple disciplines, but also it has to integrate different length scales as well. Starting from like nanoscale components all the way up to body scale components. That includes other factors too. But in terms of like most promising direction, in my view, is the emergence of closed loop adaptive digital healthcare platforms. So these are systems that are smart enough so that they can sense multiple things and simultaneously interpret those data and respond in real time. So once we achieve that, then it will, if you want to achieve this, right, and design such platforms, then it will require like deep, intimate collaboration between multiple partners, right? So for me, I was trained by a mechanical engineer, but now, and later on, I was also trained by a biomedical engineer, material scientist, and so on. But again, I cannot do everything by myself. So, so I have to work with other people who are doing like material science, uh, biomedical engineering, computer science, biology, data science, and lastly, I have to work with clinicians, right? So it needs to be happening for pretty much everybody if they are targeting like fully integrated digital healthcare platforms. If that's the case, then I think we can see bright future and also these devices and systems can make real impact in medicine and like precision therapy, smart home healthcare, things like that.
Thank you, Professor Yao, for your comprehensive sharing during this talk. And I believe our journalist readers will enjoy your talk and learn a lot from your conversation.